How to properly treat your heart.
To prevent or treat heart disease, we have to understand that heart is a very complex organ. It's not just about heart muscles or heart arteries, it also involves brain cardiocirculatory and vasomotor centers in the medulla oblongata. And the nerves control it, including vagus nerves and sympathetic nerves, and glossopharyngeal nerves. A sympathetic nerve's root inflammation can lead to heart beats too fast, because it can release too much excitement chemicals. Decreasing inflammation, the vagus nerve sends an anti-inflammatory signal to other parts of the body, lowering the heart rate and blood pressure. Evidence shows impaired vagus nerve activity can cause heart failure. Sympathetic nerves not just control arteries, also control capillaries. Not just Chinese medicine said so. Modern medicine also found blood vessels and nerves are bonded together tightly. They supply nutrients each other. If the arteries don't supply enough nutrition to the nerves will die or become ill. The nerves don't supply enough nutrients to blood vessels will be ill or block blood circulation. In fact, brain and nerves are bonded with heart and blood vessels tightly. In Chinese medicine for why, they are the yin and yang relationship. Yin supports the yang, yang energies the yin. They can not live without each other. According to Chinese medicine theory, heart, liver, kidney, lung, and spleen belong to 5 different elements. They generate and restrict each other, keep a perfect balance, so they can work as a team, healthy or ill together. So if we want a healthy heart, it's very important to keep others' organs healthy too. How does your liver affect blood clotting? Bleeding within the body activates a complex system of plasma proteins, called coagulation factors, which promote blood clot formation. The liver is responsible for producing most of these coagulation factors. Be how the body clears clots. When your body senses that you've healed, it calls on a protein called plasmin. Here's the clever part. Plasmin is actually built into the clot itself. It's there the whole time, but it's turned off. It just hangs out and waits. To turn it on, your body releases a substance known as an activator. It wakes up plasmin and tells it to get to work tearing things down. That mainly means breaking up the mesh-like structure that helps the clot work so well. Plasmin, like trypsin, belongs to the family of serine proteases. Plasmin is released as a zymogen called plasminogen, PLG, from the liver into the systemic circulation. Other things like overweight, lack of sleep, too much stress, over smoking and drinking, bad diet or lack of exercise all can affect your heart health. But there is a very important part directly affect our heart health by blocking the communication between heart and brain. That's the stiff neck. Neck area is the passageway connects brain and our heart together by all the nerves. If the neck vertebrae joints and muscles, ligaments, tendons are too tight, or sometimes a disc problem can reduce the communication between them, leading to out control of heartbeats and blood vessels problem, because all of them are controlled by nerves. Cardiovascular center dysfunction can cause heart failure. Stiff neck can affect arteries too. Brain stem, which is the center of heart functions. Stiff neck can cause both vague nerves and sympathetic nerves dysfunction. Dr. Zhao has found that regularly proper neck tuna can prevent nerves and arteries blockage, which can cause heart attack.
Hello, Ivan.
Hello,
So, how old are you?
I'm 78.
78 almost. Okay, so can you please tell me about your heart history?
Okay. I had a succession of 3 heart attacks, one after the other, annually. That was about 13 years ago. The first 2 heart attacks didn't seem to affect me at all. The third one had more effects on me and slowed me up. I've been getting along perfectly okay without medication for the last 13 years. It's only recently since
Because you come here regularly to have treatment.
Yeah. But I've been having regular treatment with Dr. Zhao now for many, many years.
It's like over 10 years.
Over 10 years, yeah.
And you, in these 10 years, almost have no problem with your heart.
That's right.
And you've been normally
If he
doing
wasn't
exercise.
any good, I wouldn't be coming. You see? But he's been a big help to me with this treatment.
And especially, you still do your exercise.
Yep.
It's like a Falun Gong exercise.
Chinese
Yeah, it's very good, isn't it?
Yep.
And also you look after your brother.
I'm a carer for a brother.
And sometimes you take him walk or take him to the hospital.
He's got type 2 diabetes. He's also got bladder cancer.
Oh.
And he's had shingles on the eye, so he needs treatment all the time.
Yes.
I also do a small part-time job as well.
Yeah. So you still do some part-time job.
I'm still doing it.
Yeah.
But once or twice a week I go.
Yeah. So you're quite fit, isn't it?
So
only recently you said you feel the heart not well, and the doctor said it's angina.
Yeah.
And how do you feel?
Actually, I had this problem with nasal
problem
called it rhinitis, and he gave me a spray, and that's where my trouble started.
Yeah.
It started to affect my chest breathing, and I couldn't walk any distance. So I stopped that. I'm now starting a new course of treatment with Dr. Zhao with acupuncture for the heart.
Yeah.
And after the first session, I felt a lot better. I felt that there was better results.
Yeah. So you feel less tight of your chest.
I don't even take any medication of any sort.
Yeah.
Because that makes it even worse.
Yeah. So you're breathing well and walking better.
A bit better, yeah.
Yeah. Okay.
Yeah.
Okay. Thank you very much, Ivan.
Yeah.
And thank you for your talk.
You're most welcome.
Thank you. Okay.
Yeah.